Hi, Dr. Coucher. We're going to be talking about conflict management for this lecture. Also, I did provide you guys with a few extra YouTube videos that I would like for, I'm not telling you have to, it's never extra content from YouTube is testable, but not everyone is great with conflict management. So it might give you some tools in which to utilize to help you with that. And let me just say right now, I'm really sorry about the glare that's in my glasses. I have tried everything with my screen and my lighting to make it better, but I'm on the struggle bus with it. So is it normal? Is conflict normal? The challenge is to know what it is, when it happens, what to do about it, and when it's recognized, what exactly it is. About 90% of an average leader's responsibility involves dealing with human behavior and human interaction. Given that this is true, why do you think it is that leaders spend so little time actually learning how to resolve the issues that arise out of the human dynamics? I mean, if we were in a classroom, I would probably stop right here and ask why it is that we want to avoid it. Think about it. So here's my answers. I believe this is because human nature kicks in and we all would prefer to ignore the conflict. I know I don't like dealing with conflict. It makes me very uncomfortable. And I think for the most part, unless you are just a diehard conflict resolutionist, I think that conflict makes just about any of us uncomfortable. When we hear about it, when we see it, when we're involved with it, we're just like, you get that feeling on the inside of you. It's like, this is just not right. I think this is particularly true in healthcare. Nurses may, in fact, do their best to avoid the conflict. Conflict is central to all human interaction, and it should or should not be resolved. What would your answer be? What happens if we don't resolve that conflict? This is what we're going to kind of talk about throughout this lecture here. When conflict should be resolved is when you feel very uncomfortable in a situation. Remember, it makes you uncomfortable. So yes, it should be resolved. We should be taking care of it. When members of your team are having trouble working together, I think we've all been involved on teams, or we've seen teams where the interaction is just like, ooh, they're butting heads. You can see it in how they act. You can see it in how they react to one another. Oh, she's coming on. It's going to be a great shift for all of us. When team members stop talking with each other, they kind of talk at each other, but they don't talk with each other. When team members begin losing their cool and attacking each other verbally, let me just tell you, I was somewhere with students, and I will never tell where this occurred. But I was somewhere with students once in clinical, and they were having some massive changes that were occurring on this particular unit, and everybody was just, there was internal conflict because they did not like the changes that were going on. And this resulted in some external conflicts. And I have never seen, in all my years of nursing, never seen people standing in the hallway yelling at one another with fingers pointing about how they were going to be written up and this and this and this. And it was just, oh my goodness, it was, the students were kind of just backed up against the wall and not sure exactly how to react or what to say or what to do. And I spent the better part of the clinical conference, the post conference, trying to talk about conflict management. And I think I did my whole lecture before I did my lecture. Excuse me. So there are no conflict-free work groups. In fact, conflict in any relationship is pretty much unavoidable. Conflicts are a daily occurrence in the life of nurses, and they can interfere with getting work done. A serious and unresolved conflict can be very stressful. You can have difficulty concentrating. You can have anxiety. Think about going into an environment where there is this conflict that's unresolved. You're going to feel that anxiety. You just don't want to go in there. And it may not be an external conflict. It could be an internal conflict within yourself. You don't like this place that you're working. Every day that you go in, there's something new. There's something more dramatic. There's something that it's going to come back to you, or it may be just that you haven't liked this place of work since you started there. Maybe there are certain aspects of the nursing care that you don't like. If you're dealing with patients that are hospice patients and you thought you'd be good with that and you were comfortable with that because you loved it when you were with a family member as they were passing away, then you have your own internal conflict when anxiety arises going into this place of employment. You have sleep disorders, you withdraw, you have bitterness and anger, and then there's workplace violence. Conflict simply categorizes our deep and abiding understanding of the fundamental diversity that exists in any human experience. We're all diverse, and we all have different ways in which we deal with conflict. It has to be managed, though, in the workplace. Management is the key to negotiate our differences and work to find some common ground. We have to find that. When conflict is dealt with effectively, teams can begin to work together and be more open and cooperative with one another. Team members begin to see each other as people with similar needs, concerns, and dreams instead of competitors. Being involved in successful conflict resolution can be a very empowering experience. The goal in dealing with conflict is to create an environment in which conflicts are dealt with as cooperative and constructive a manner as possible, rather than competitive and destructive. And we're going to talk about some of those different ways that we can manage those conflicts. We have different ones. We have interpersonal conflict. This occurs when the person, and it occurs within the person, and it can involve internal struggle related to contradictory values or wants. An example: a nurse wants to move up the career ladder, but is finding that time with her family or his family is subsequently compromised. There's a big interpersonal conflict going on there. Interpersonal conflict occurs between two or more people with differing values, goals, or beliefs. In healthcare setting, this involves disagreements among nurses, patients, family members, and within the healthcare team. Bullying and incivility in the workplace are forms of interpersonal conflict. It is a significant issue for new nurses because they bring new personalities and perspectives to various healthcare settings, and it contributes to burnout and work-related stress. An example: a new nurse is given a patient assignment that is heavier than those of other nurses. He asks for help, but is denied. And I can see where some of you who have been LPNs for quite a while can go into the healthcare setting as an RN and be oriented by someone who, and it's a very real possibility that you're going to be oriented by an RN who might have been a nurse for less amount of time than what you have been a nurse. And so you're going to bring in a different viewpoint and a different set of values. You're going to bring in a different work ethic, and you're going to bring in a different set of knowledge that maybe that could bring on some conflicts there as well. You might have that new nurse that's like, what does this person think they're doing? But you just need to stand your ground, and you need to understand where they are coming from, and hopefully have them understand where you are coming from. You can probably deal with the conflict by stating, well, I understand that this may have been how you learned, but I've been an LPN for years, and this is how I learned to do this. Could we talk about it and find out, Um, Maybe there's some evidence-based practice that supports the way that you do it over the way that I've been doing it that I need to know. I mean, there's the ways that we can avoid this kind of conflict, and instead of getting mad and switching preceptors, talk it out and work it out. Intergroup conflict occurs between two or more groups of individuals, departments, or organizations, and can be caused by, let's say, a new policy or procedure, a change in leadership, or a change in organizational structure. An example of this would be there's confusion as to whether it is the responsibility of the nursing unit or the dietary department to pass meal trays to the patient. This can this can cause some conflicts, really can. I think probably some of you have seen something like this. Some sources of conflict: power plays and competition between groups, differences in status and authority within healthcare teams. It's disrespect and incivility. There could be sarcasm, finger pointing, throwing things, and inappropriate language. Workplace bullying. And workplace bullying happens way more than what you actually probably think. Unless you have encountered it quite a bit, I'm telling you, it's out there, and there's way too much of it. Team members who feel powerless, trapped by the demands of the job, and frustrated that quality patient care cannot be given. Disagreements over professional territory. As I was talking about on the previous screen, that you've been an LPN for years and you're being trained by a new RN. Gender-based issues and diversity issues. Another source of conflict is increased workload. There's emphasis on cost reduction that has resulted in some work intensification. This is a situation in which employees are required to do more in less time. I think we're seeing a lot of that. Common responses include skipping breaks, doing paperwork over lunch, and working overtime without pay. This leaves healthcare workers believing that they are being taken advantage of and are not appreciated, which leads to some resentment and conflict. Some other sources of conflict: multiple role demands. Cost control efforts can lead to nurses being asked to take on inappropriate tasks and assignments, such as cleaning rooms after a patient discharges. Threats to safety and security. Cost saving is emphasized, and staff members face layoffs or position changes. Causes considerable stress and tension as well. Scarce resources. We have inadequate resources for pay raises, equipment, supplies, or additional staff. This causes a conflict between staff and management, as well as competition among team members. Cultural differences. Different beliefs about how hard a person should work, what constitutes productivity, and even things about what it means to arrive at work on time. I think that we see a lot of this, and I know I'm going to show my age and not show the fact that I'm old, but I get to work early and start my day a little bit early. A lot of the younger generation just don't do that. I struggled with that when my daughter graduated nursing school. And she pushed it to the wire, to the absolute wire on getting herself to work. And we see those types of people, and they roll in late each and every time that they are scheduled to work, and we're always having to give them report late. It can be very, very frustrating to us, and to us that get there on time when we're standing there, um, waiting to give reports so that we can go home. They don't call, they don't let us know. So you've got some of this going on. You do have, and I had a student once, and I can remember her name, Vivian, and she always rolled into clinical, later than everybody else. And I was like, Vivian, you are on US time now. And she was like, no, I am on Nigerian time, and Nigerian time is different from y'all's. So you know what I did? I just chalked that up as, you know what, she is right. I mean, she has some cultural differences. Um, her arriving on time for work was getting there, probably 10 minutes later than everybody else. But it was just, and it was just her culture. That's how she grew up. That's how she's lived, and that's how she continues to live. You don't change that. You just need to accept that, and you need to understand that as well, because we all have our cultural differences, and we need to respect those. Languages, language differences also can lead to challenging communication between team members. I worked with someone that she was from the Philippines, and she'd been over here for a long time, many years, but she still had difficulty pronunciating some words, and so I would have to ask her to repeat things, and I always felt guilty doing so. But at this point in time of her life and her working life, she was so used to it, she would just repeat it, and she never got upset. And that is a great, to me, that's great teamwork. That's the ability to take the cultural differences and not allow them to be a conflict. But others do. Others allow it to be a conflict. And instead of asking that person to repeat it, or, accepting the fact that they might talk slower and they might have a little bit more difficult time pronouncing some words, they will just want to just scurry on and say, well, I'll just get it later. And then when that person leaves, what do? They gripe and complain because they couldn't understand a word they said, and they have to go and they have to pull up their report from the computer. It's just ridiculous. That is so disrespectful, and it's so uncalled for. There's also ethical conflicts. We have moral distress that occurs when a nurse that encounters a situation that violates his or her personal or professional ethics. I think we're seeing a lot of this more and more. I can think of the first one, of course, that pops up to the top of my head, and I guess it's because it's always there, is abortion. Um, that people don't, there's a lot of folks that don't want to work with anybody, who is having an abortion. So it goes against their personal ethics. And there's nothing wrong with that. You need to be able to identify that. You have Jehovah Witnesses that don't take blood products, and you might find that's a professional ethical problem, because you feel so strongly that they need that blood product, and you don't you just it causes an internal conflict because of it. You just don't understand. You want to be able to talk them out of it. Adoption is another conflict that can occur, and also when we're withdrawing patients from care and we're allowing them to pass and to pass peacefully. This can cause some professional ethical conflicts within you. I knew someone once who didn't want to work on BHEC, and they withdraw up on BHEC quite often. And it's not because that's the first choice. That everything's been done to take care of that patient, and they he or she is not coming off the vent, or he or she is not going to get any better, and it's been tried. It's everything's been done, and she just said, I can't do it. I feel like every time we withdraw that I'm killing the patient, and I'm allowing them to die. And it was a very big ethical conflict. Another one that I can think of is, and I'm just naming things off, guys, is hospice. I struggled with hospice myself. I thought hospice was a great place to work, and it would be wonderful to be there when somebody was taking their last breath, if possible, and to support the family, until I was one of the family members that went through it and had to give my mother the medications. And you you kind of feel like you're putting them down, like you're putting a dog down. There are some things like this that cause that moral distress within us. Invasion of personal space. Crowded conditions and constant interactions that occur at busy nurses stations can increase interpersonal tension, excuse me, and can lead to some conflict. Right now, we have COVID-19 going on, and I'm sure that for some people the invasion of personal space is a big conflict right now. You have everybody in a small area wearing a mask, and there's no way to be 6 feet apart. There's not any way. Yet we're told that we need to make sure that we remain 6 feet apart in the cafeteria when we go down to eat. And so there's a lot of conflict, I feel like, there with, especially as a faculty member. What do? Do I have my students in there, or do I have them standing out in the hall being 6 feet away from everybody else? I mean, what do I do? If I want them to learn, they're going to need to be with their nurse, but their nurse is sitting in a fishbowl, and there's maybe 2, 3 other nurses in there with them, and they're charting, and they're not sitting 6 feet apart. So do I put my students in there and allow them to hear what's going on and be able to be involved? So for myself, I find that personal space is a conflict, and how do I handle that? Demanding rude and unrealistic patients and or family member expectations. A culture of patient satisfaction ratings and entitlement is, oh man, it's off the charts. Nurses on the front line receive complaints about just about everything, from the hospital noise, hospital food, physicians that do not make rounds quickly enough, delayed diagnostic testing. It goes on and on and on and on and on and on. And so what happens is these surveys go out to these patients once they're discharged, and they remember my name, Elena. And so they say, well, I was so unhappy because Elena did not get my meal in there in time, and it wasn't hot. And I know that I ordered from the line, but she should have gotten it to me a lot faster, even though I'm not the one who takes care of those meals. Or Elena came in to clean my room at 4 o'clock in the morning, and I didn't appreciate that. Not that any housekeeping comes around at 4 o'clock in the morning, but they're looking up at the clock. Maybe they don't realize it's 4 o'clock in the morning and it's actually 4 o'clock in the afternoon. Anything, but they remember my name, and I was not the one that came in there at 4 o'clock in the afternoon and wiped their floors and changed their trash. We're in a hospital. We're not in a hotel. Excuse me. But that's how it's treated anymore. Patient complaints, they remember your name, and then it becomes a conflict with you and administration, and you feel the conflict with the patient or the family members that are doing the complaints about you. I mean, I didn't even do that. Why am I being called out and called on the carpet for it? So what do we have as stages of conflict? Stage 1 is a latent conflict. The actual conflict has not yet developed. However, factors are present that have a high likelihood of causing the conflict to occur. An example, a new scheduling policy is implemented with the organization. The nurse manager should recognize that change is a common cause of conflict. Stage 2 is the perceived conflict. A party perceives that a problem is present, though an actual conflict might exist. An example, a nurse perceives that a nurse manager is unfair with scheduling. The nurse might not be aware that it is only because the nurse manager misunderstood the nurse's scheduling request. I don't know how many times that I've actually emailed a request in or asked for something in particular, and I'm like a over communicator. No lie. Y'all see my emails. I just always over communicate, and sometimes I might think that my communication is coming across as congruent, and it's not. So I'm like, well, I don't understand. Why couldn't I have done that? When really, in all reality, I could. Okay? I could have done it, but it was misunderstood what I was actually asking. I had this happen I want to say just last week. I emailed someone and said, listed everything and what would you like for me to do? And they went back and said, well, do such and such. And I was like, wait a minute, that, and, you know, I wish I could tell y'all what it was. But anyway, they went back to the first sentence of the email and didn't really read the rest of it. So I had to email the person back and say, hey, no, this is what I'm talking about. Stage 3 is felt conflict. Those involved begin to feel an emotional response to that conflict. An example, a nurse feels anger towards the nurse manager after finding out that she is scheduled to work 2 holidays in a row. Stage 4, the manifest conflict. The parties involved are aware of the conflict and action is taken. Actions at this stage can be positive and strive towards conflict resolution, or they can be negative and include debating, competing, or withdrawal of one or more parties from the situation. An example of that would be the nurse manager and nurses on a unit agree that the current scheduling system is causing a conflict and agree to work together to produce a resolution. Stage 5 is conflict aftermath. The conflict aftermath is the completion of the conflict process, and it can be positive or it can be negative. An example, and I'm going to give you a positive and a negative one. So the positive one, the nurse manager and nurses on a unit are satisfied with the newly revised scheduling system, and they feel valued for being included in the conflict resolution process. I mean, if it were me, I would feel great about being involved in that. If if I wasn't able to be involved and the nurse manager just thought she could do it on her own, or he could do it on their own, and it wasn't actually solving anything, because they are not the ones that it's affecting. It's all of us it's affecting. An example of a negative one, the nurse manager and nurses are unable to produce a scheduling solution that meets both needs of both parties. They agree to continue with the current system, however, tensions remain increased and the risk of recurrence of the conflict is great. Conflict occurs at any level and may involve one or multiple people. Like I said, conflict is unavoidable in life. The unfortunate realization is that healthcare has been resistant to having effective conflict management. The Institute of Medicine report, IOM, and this is from 1999, to Err is Human, it exposed the seriousness to patient safety due to preventable errors. And it made it very clear that problems need to be resolved and not just swept up underneath the rug. If you don't take a problem and connect a resolution to it, then what happens? That problem keeps occurring over and over again. That conflict keeps occurring over and over again. Joint Commission even addressed workplace violence that arises when conflicts are not resolved. And for hospitals to remain accredited, if Joint Commission puts out a mandate, then it is up to them to ensure that that mandate is on their books, that that policy is created, and that it is presented to the employees of the institution. If they don't do it, if they don't follow the mandates of Joint Commission, then they are not going to keep their accreditation. When a conflict turns into bullying, then we've reached another level that needs to be dealt with timely and efficiently. In a 2013 journal article posted on the Workplace Bullying Institute, and this is a .org website, there are greater than 60% of nurses who experience some type of unresolved conflict, which becomes a workplace personal hell for others. That's terrible. That is too much. We've got to learn how to deal with the conflicts. And I think some of what we have to do, and even myself, I say this for myself, in order to deal with conflicts, we have to learn how to deal with it within ourselves so that we can take care of it when it's from external sources. When we're resolving the conflict, we cannot look at interprofessional conflict the way we view a baseball game where someone has to win and someone has to lose. That's not resolving the conflict. I heard the best statement last night. I won't even say what I was watching, but the person said that right now everybody's going in with closed fist and it's not solving anything. We need to start going in with our hands open, with palms up, so that we can say that we can solve this problem together. This type of comparison with the baseball is ineffective because in conflict resolution, the aim of conflict resolution is to work together more effectively, palms open and up. If a person feels like they've lost, then they are looking for future opportunities to win instead of focusing on the work at hand. The best resolution to conflict would be a win-win situation where both sides gain some benefit. When parties cannot reach agreement but can recognize and accept their differences and get on with their work with the entire organization, then there's a win. So avoiding or withdrawing, these are some strategies. I know that avoiding or withdrawing doesn't sound like a strategy, but it's how sometimes we resolve our conflicts. But the problem is the conflict remains. We have a lose-lose situation. What about smoothing it over? I'm probably a smoother. It's often used just to keep the peace, but the conflict remains, and it's a lose-lose situation still. And I myself have to learn not to smooth things over. And I've always been that way, and I recognize that in myself. And you have to learn to recognize these things in yourself so that you can do your own quality improvement, so that you can exert that quality improvement onto other aspects of your life. Competing or coercing. One party pursues a desired solution at the expense of others. Managers may use this when a quick or unpopular decision must be made. This is a win-lose situation. They won, we've lost. I think we see a lot of that today in our society. And again, it's not solving anything. I'm not trying to talk politics or anything, but the government can make decisions that based upon what they're wanting and not based upon what we're needing or wanting. And so what does that do? That gives them a win situation, and that gives us a lose situation. That was the worst example probably in the world because it had to do with you know, politics, but it was one that I could think of. Or how about when the manager makes a decision based and decides that I'm going to make this decision and we're going to do it this way, but she doesn't or he doesn't consider the employees. Maybe it got them a nice little bonus, but it didn't do anything for us. Again, a win-lose situation. Cooperating or accommodating. One part sacrifices something, allowing the other party to get what it wants. This is opposite of competing. The actual problem may not get resolved. The solution may contribute to future conflict. So it's really a lose-win situation. Compromising or negotiating. Each party gives up something. To be a true win-win solution, both parties must give up something equally important. If one party gives up more than the other, then it turns into a win-lose solution. So what we're hoping that we can get is the win-win. Okay, so everybody needs to learn how to compromise in this, and we need to negotiate with our palms up and open so that we can achieve what's best for everybody concerned. Actions to de-escalate conflicts. Use I statements and remember to focus on the problem, not on your personal differences. Listen carefully to what others are saying and try to understand their perspective. Well, that's a big, hard thing for a lot of people to do anymore in life, and I don't understand it. I was not brought up that way. I was brought up in a manner that we respected everyone. It did not matter what their race or color, what their religion was, what their own personal beliefs were, what my own personal beliefs are. It did not matter. It just didn't. We respected each other and we loved each other. Um, and if somebody had a different perspective on a problem, a different perspective that offered a solution, then I've always been, again, my upbringing, I've been one that I would listen to what others had to say. Um, and in this day and time, everybody is dead set that their perspective on a situation is the right one. And no one wants to listen to anyone else. No one wants to believe that there is a different perspective. And that is just not going to offer any solutions when there are conflicts. Move a conflict that is escalating to a private location, or postpone the discussion until a later time to give everyone a chance to regain control of their emotions. If the conflict arises in the middle of the hallway on a unit, you do not automatically start screaming at each other and throwing slander back and forth at each other and cussing at each other. If I had been privy to this, I probably would have asked that the people involved could take it to a private location. Hey guys, let's go in here. Let's take it in here. And I know that you're probably going to face people that are like, I'm not going anywhere. But we don't need to do this in the hallway. If you have a conflict, move it somewhere. Don't talk about it in front of other people. It's just like even with your kids. I know with my kids it was, oh boy, they just it's hard. That's my example. I'm sorry, kids, because you don't want to yell at your kids in public or make a scene in public. But sometimes you have to know that it's important that you move them off from in front of people, because it doesn't do anything but humiliate them. And I use that as an example because we all have that knee-jerk reaction where we want to say something and we want to do it right then. We don't want to wait. Share the ground rules with the participants. For example, everyone is to be treated with respect. Only one person can speak at a time, and everyone should have a chance to speak. I think that goes back to listening carefully to what others are saying and try to understand their perspective. Problem resolution process. Open communication among staff, between staff and clients, can help diffuse the need for conflict resolution. When potential sources of conflict exist, the use of open communication open communication and problem-solving strategies are effective tools to help us de-escalate. Clearly identify the problem or the issue, state in objective terms and minimize emotions, generate possible solutions, brainstorm solutions as a group. It may stimulate new solutions to old problems. I still go back to that open hand. My husband told me last night, he's like, why are you, why, I mean, I focus on that. I'm just like, that's probably one of the best things I've heard in a long time, is to not go in with your fist like this, but with your hands open. And I guess, if you think about that, I'm at a Pentecostal church, and we raise our hands in prayer and praise, and so you raise your hands with your hands open to receive. So if you both go in for a resolution with your hands open, then you're going to receive what each other has to say. Evaluate suggested solutions. Identify pros and cons of each possible solution to narrow down the viable options. Choose the best solution. That's based on analysis. Select a solution for implementation. If you don't know, then let's discuss it together. Let's figure out if there's a best practice in order to solve that problem that exists. Implement the solution. A procedure and timeline for implementation should be decided, and evaluate. It sounds kind of like the nursing care plan, doesn't it? Evaluate the outcomes of the new solution. Is the problem resolved? If not, we're going to start the process all over again. Open communication, as I said, among staff and between staff and clients, can help diffuse the need for any conflict resolution. I I want you to learn tools. I want you to think about, you have to think about yourself and how you identify with all of these different types of people when conflicts arise, because we all are different, and you need to figure out how you can do things differently. And first of all is you have to determine what conflict means to you and how you try to fix it. Now, this is a TED Talk that I have listed on here. Y'all, it is a 19-minute video, and I'm asking you for the rest of this lecture to listen to it. This is Use It, Don't Diffuse It. This is about taking a conflict, and it has two women. They both have different ways in which they handle or dealt with conflict in order to achieve resolution success in life. So I want you to watch it for the remainder of this lecture. I wanted to play it, but again, I can't figure out how to do so on here. It is full of valuable information, and it does reinforce this lecture and help with some of the de-escalation that we need. Thank you for